So my work at Moffitt predominantly is in the setting of patients who are coming forward for either stem cell transplant or more frequently for CAR T cell therapy or chimeric antigen receptor T cell therapy. And my huge area of interest is about how can we do this better? How can we make it safer? How can we maximize the effectiveness that patients get? Because I think what patients want most is the most effective therapy that they can safely tolerate that will offer them the best quality of life. And ultimately, most patients will be accepting of maybe an increased risk of toxicity up front if they think that down the line they'll have better disease control, they'll be on fewer medicines. And I think that increasingly that's what patients come and tell me. And so my research is around how can we optimize patients who are coming forward for these treatments. And some of that is about better disease control, but also about optimizing their frailty, optimizing their other conditions. And we also have a pre-rehabilitation study ongoing for patients who are older coming forward for CAR T cell therapy. With supervised exercise and monitoring their fitness and their ability to improve as they prepare for their CAR T cells, with the idea that if we optimize them before they have their therapy, these therapies will be easier for them to get through and they'll have a quicker recovery. The other thing I'm really working on is how can we do better with CAR T cell therapy? So how can we achieve more durable responses? How can we optimize patients both in terms of their disease burden, and maybe how can we make these CAR T cells to work better? Is it with optimizing the cells that come out of the patient? Is it by going after different targets? Is it by making them fitter in terms of how we manufacture them? These are all things that I think are going to be hugely interesting going forward, and we're really trying to work hard so that these treatments that can offer patients a treatment-free interval, a drug holiday for the first time in their disease course, that we can make them better, work longer, and ultimately offer them more durable remissions. So the patients that we offer outpatient CAR T cell therapy, it's generally speaking those patients who are otherwise fit and well and who have fewer other medical problems that make us worried about how they'll tolerate the CAR T cell therapy. But also it'll depend on the product. So some of the products will act fast, they'll expand fast, and they'll cause reactions fast. And often those are the patients that we admit straight away on the day they get, or the day before they get their cells. For those cells that work a bit more slowly, we'll usually start the patients as an outpatient and only admit them if they develop their symptoms, their fevers, or other issues, side effects, toxicities that mean we want to watch them more carefully on the inpatient side. Some of them are under trial at our institution, some of these remote monitoring devices. We also get the patients to be seen at our outpatient service. We're still not fully confident that they can fully replace seeing the patient in person. And we also do afternoon checks for the outpatients in terms of looking for neurological consequences. But generally speaking, we're trying all these devices out. We're trying out these remote monitoring, these Fitbits, trying to see is there ways that we can minimize the patient experience in the hospital, but also make sure that we're not compromising on safety. At Moffitt, we have a dedicated exercise physiology research center, and that's headed up by Dr. Parker. And he's working with me and a lot of the other colleagues that work at Moffitt about how we can use exercise as a tool to optimize patient outcomes and patient experience. And so one of the trials that we've developed together is looking at pre-rehabilitation strategies for patients coming forward for CAR T, because there is this period between where we identify that a patient is going to be a candidate for CAR T therapy and when they actually get their CAR T therapy. And that's a perfect window to really work hard and try and optimize how the patient is, both in terms of their fitness, in terms of their strength, in terms of their general overall wellness. And we think that this is a perfect window to do a prehabilitation. So we're working directly with patients, one-to-one, supervised in their own home. So it's remote. They don't have to come to Moffitt for their exercise programs. They're going to do supervised programs twice a week with resistance bands tailored to them, to their exact needs, what they can do and what they can accomplish. And then they'll also have aerobic exercise that they'll do themselves, and we'll monitor that with a Fitbit that they'll get to keep after the trial is over. And we're going to basically see how they do. Can they manage to get through the sessions? How do they feel? Does it impact on their overall outcome, their length of stay, how the side effects that they experience from their CAR T cell therapy? And we feel that this is likely to have a very positive impact on the patient's experience and how they do with their CAR T cell therapy, and we're hoping to expand it into a bigger study.